Health officials in BC say masking in indoor public spaces is encouraged. They spoke to reporters last hour. The CBC's Sarah Galashan has been following this story for us and joins us now live. Sarah, what more can you tell us?
Hannah, what you said there, that is really the headline as we watch respiratory illnesses right across the country on the rise. The question, of course, is to what end masking should be brought in? Should it be made mandatory? And today we heard from BC's Chief Public Health Officer, Dr. Bonnie Henry. Her answer to the idea of mandatory masks is no. She was at pains to explain why and to say that there are many other ways of preventing the spread rather than mandatory masking, but rather encouraging people, anyone with any symptoms, even if they're slight, to be wearing a mask in public places, in workplaces. She even went so far as to say if there's someone in your home who has symptoms, that you should wear a mask within your home as well to try and stop the spread. And as well, if you are feeling ill at all, simply stay home until you are feeling better. But really, this is her bottom line. She believes a mandate would be too heavy-handed. Let's play that clip.
I do not believe we need that heavy hand of a mandate to send a clear message that masks are an important tool that we can all use during this time and in every respiratory season. We should have one with us. We should use it in situations where it makes sense.
As far as COVID goes in British Columbia, she says BC has a high immunity at 86% of people with 2 doses. That's for ages 5 and up. That hospitalizations, as far as COVID goes, are actually coming down. And wastewater surveillance shows that COVID right now in the province, while it's still out there, is right now low and stable. But in the last week, what we have seen is a spike in flu cases, respiratory virus, RSV, as well as in other common colds. And Dr. Henry said that RSV, they are watching closely. It was circulating in British Columbia last winter. She speculates that perhaps there may be higher immunity in BC compared to maybe other parts of the country, like Ontario. We're seeing that being a real issue. But she did stress that that flu and COVID, these are things that are preventable in that there's vaccines for them. And she encouraged everyone in BC to get a vaccine, saying you can get those vaccines at the same time. And in particular, she talked about children, saying, because while I talked about a high vaccination rate in terms of COVID for 5 and up, when you specifically look at children for COVID, it's 51% with a single dose. And so she said if that number could be higher, it could slow the spread for both a flu and COVID. And at the moment, they talked about hospitals saying that they are at capacity. There are plans in the works. Should it be needed, there's extra capacity that can be brought in. Not necessary right now, though, Hannah, they did acknowledge the long wait times that we're seeing in emergencies and how the number of children being brought in is contributing to that.
And Sarah, health officials in Quebec also spoke about masking earlier. Tell us about that.
Right. Well, we heard from the province's public health director in Quebec talking about this triple threat, COVID, RSV, and the flu, calling it a, quote, spicy cocktail that could last at least the next couple of weeks, if not the next couple of months. But Premier Francois Legault insisting there was, quote, no question of reinstating a mask mandate and that was not being recommended by the public health and as far as a mandate goes. And this is what we heard from public health on that.
We do not need right now to make it mandatory. It's something that is that needs to be considered really delicately, because you put a pressure on citizens, and with other measures that should accompany that. We're not at that point. I think that we could manage to get through this with the recommendations that have been said by the minister, and with that in mind, I think we'll get through.
As far as that recommendation goes, it is that masks be worn in all crowded public spaces, that applying to all ages. As I say, that's a recommendation, not a mandate. And important to note here, Hannah, that recommendation does not extend to either schools or daycares.
Okay, Sarah, thanks for filling us in. CBC's Sarah Galashan. Now, I want to stay on this topic. Dr. Anna Wolak tuned in to that briefing in British Columbia. She's a family physician practicing in Vancouver. Welcome to the program, Dr. Wolak.
Thank you for having me.
I want to kind of paint a picture first for viewers. What are you seeing on the ground?
So as a family physician, myself and a number of my colleagues are all reporting that we are seeing far more numbers of sick children coming in. They're coming in earlier than we expect because we technically haven't hit cold and flu season yet compared with previous years. And a lot of us are having to fit in upwards of 5-6 kids on top of our day just to see these sick children. And this is on top of what is presenting in the emergency rooms. And as of this morning, BC Children's Hospital had a 12-hour waiting time to see the emergency room physicians. And parents were reporting that you couldn't even stand in the waiting room because there just was no room.
12-hour wait time with a sick kid. Just imagine that.
Yes, that was somebody was interviewed last night, and they had said that there were at least 50 children who were waiting to be seen. So that would have contributed to the 12-hour wait time this morning. And that didn't even include the patients who were waiting to be triaged. So we're seeing the numbers rise. It's not the 24 hours that Ontario is seeing, but as of last week, BC was seeing 8 hours or 9 hours. So it's growing, and that's where a lot of the concern is coming from.
Now, you listened to the press conference as well. You were not expecting a mask mandate. Why is that?
Oh, that's because Minister Dick said yesterday that we were not to expect anything big, any big announcements. And I think he specifically had said mask mandates. So that's where that came from.
Yeah. Are you disappointed with that? Do you think people will listen to this polite ask of, I recommend you wear a mask in indoor public spaces?
I am disappointed because we have seen that asking nicely over the last 3 years, it's not working, and it's not getting the gravity across. And that's the bigger thing with mandates. Dr. Henry had called it the heavy hand of a mask mandate, but I feel that the gravity of the situation facing our children requires the heavy hand of, this is where we are at, and we need to impose this because we need to stop the children's hospital system from collapsing. And that's why I was happy to hear that there was some guidance about mask use, and they were a lot more vocal today about using masks and the need for masks. But stopping short of a mandate 3 years into a pandemic with pandemic fatigue setting in, I feel that without the mandate.
Now, I think we're having a little bit of problem with your audio. Do we have Dr. Wolak back? We're just trying.
I'm here.
Okay, there we go. We got you back. Sorry about that. Technology these days. But let me just go back. You were talking about the mask mandate, and you're hoping, or had hoped, there would have been one. Could you see one eventually coming down the road?
I'm not sure. I worry that if it does come down the road, it's because it's too late and the hospital system has collapsed. I was hoping that we could take the precautionary measure and try to bring this in before the hospital system collapsed. So I'm hoping if it does come, it comes earlier than that, but I'm not holding my breath.
Let me ask you about something else we're seeing in the news as well, and that comes with, medications for children who are getting RSV, the flu, those types of things, fevers, and there's a lack of that type of medication. When a parent comes to you, what's your advice to them?
So what I have been doing with my own patients now is, whether they're coming in for just a usual checkup or if they actually are sick, then I weigh the child, make sure I get their weight in kilos, and I talk to the parents about how to appropriately dose an adult tablet and crushing it up, cutting it up accordingly and crushing it and mixing it with a medium of choice, be it. My patient cohort seems to prefer pudding, but other doctors use jam, Nutella, peanut butter, applesauce, mixing it in with a teaspoon of that and guiding patients through that, because they are hard to come by. I know the Prime Minister has said we've We've gotten some acetaminophen coming, and then we know some ibuprofen is coming. So it's there, but I want my patients and patient families to be armed with the knowledge that not to panic, and this is what we can do to treat your child.
And just quickly, if someone doesn't have a family doctor to get that type of advice.
So you can talk to your pharmacist, you can talk to the local pharmacist, they're able to do that, or calling the nurses hotline. I know they're able to do that as well.
Lots of great advice there. Appreciate you helping us with this topic. Very important. Dr. Anna Wolak, thank you for coming on the program with us.
Thank you for having me.